This segment of DelmarvaLife is brought to you by Delmarva Dental Services.
You know, when it comes to scams and ripping people off, sadly, there's really no limits to what's possible. You're probably familiar with identity theft, tax scams, credit card fraud, wire, mail fraud. Have you ever heard of dental fraud? It really is a thing, and it's happening more than you might think. So what is it? How do you protect yourself? Well, for those answers, we turn to Dr. Joseph Harmon with Delmarva Dental Services in Salisbury. Thank you so much for coming in this afternoon.
Glad to be here, Jimmy.
You know, I'll be honest with you. When you brought this topic up, first off, I don't think too many people have thought about it. I know I'd never considered it. Dental fraud happens a lot, doesn't it?
Well, it's always happened. Just like any profession, there's honest people and dishonest people,
Right.
and dentistry is no different. But I've been practicing for 38 years, and I've seen it. I don't know if it's any more frequent. It may be a little bit more frequent, but really the bad thing about it is when you're a victim of dental fraud, you really don't know that it happens. Unlike if somebody scams you out of money and then you find out you're ripped off. But dental fraud, you pretty much just go on your merry way and don't even know.
Because you don't know. You
don't know what you don't know.
You don't know what you don't know. So what is dental fraud?
Well, basically, anytime you are being paid for something you didn't do and you're not being honest about what you did, that's dental fraud.
So, man, it is that simple. Are there different types of dental fraud?
Yes, there are different types of dental fraud. There's dental fraud, there's 4 different types of dental fraud. There's basically when you're being paid for something you didn't do, okay?
Right.
In other words, you say that a good example of that would be if you took 2 x-rays and you said you took a full set of x-rays.
Okay.
Okay, that would be, or another thing is you can upgrade what you do, make it seem more complicated than what you do.
Okay.
So that would be like if you do a routine extraction, you say it was a surgical complicated extraction.
Okay.
And you bill the insurance company, and you bill the patient for something more complicated than it
Make
really
it more
was.
than it really was.
Another thing you can do is do treatment that's unnecessary.
Right.
What I've seen recently is when you do a crown or a cap, not every tooth that has a cap needs a root canal. I've seen some practices saying that, oh, you need a root canal too. That basically doubles the cost of the procedure. So you do the root canal and the crown. But many times it wasn't hurting to begin with, or it didn't have an abscess on it.
Right.
So, but it's a money maker because it doubles the procedure. So I've been seeing that happen a little bit more than I had in the past.
Okay. All right. So there's 3. I've heard of something called unbundling. What is
unbundling. That's a good one. Unbundling is basically, think about like if you bought a submarine sandwich for $10.
Okay.
Okay, and it's got everything.
All right.
Okay. Now I'm going to bill it differently. I'm going to bill you separate for the meat, separate for the pickles, separate for the onions, and it's going to cost $12.
Okay. See, now I get that. That I understand. Okay. So there's.
And you can do that with insurance, and you can send it that way rather than do the together. So certain things are done together all the time. Like you always would numb somebody to do a filling, pretty much.
Yeah.
So charge them for the numbing, charge them for the filling.
And
separate.
Unbundled, it's going to cost more. Is there anybody that you would consider a typical target?
Well, it's interesting. There's 4 typical targets, and the first one is be Medicaid. It's government, because, and the reason that is because the government really doesn't look over it's not their money. They don't look over their money, so people get away with things easier when they submit it to the government rather than if they submit it to a private enterprise.
Okay.
So they're not as scrutinized as heavily. So you see a lot of Medicaid fraud. And you see it in medicine, and you see it in dentistry too.
Yeah.
So that's one. The second one is certain groups, like certain groups of people, like dental chains tend to do that. And the reason dental chains tend to do that is because there's a third party involved. In other words, I'm a dentist and I own my practice with my partners, okay? Yeah. Now you bring somebody in that owns or advises me about my practice.
Right.
And they look at my statistics and they say, well, you're not doing enough crowns based on our other practices. And then they'll teach you how to upsell and how to do things like that. And that's been,
Oh my
there have been lawsuits about that. So it's kind of because you've got another person involved in getting the money. In other words, you have another third-party investor
Right.
who's not a dentist usually, influencing your treatment decisions.
Wow.
So that's another, and children are also another group. And the reason children are another group is because children don't really know like an adult. For instance, if I did, one of the common things is instead of doing a filling, they'll do a stainless steel crown because you make more money on a stainless steel crown. So if a tooth needs a filling and if you see a tooth and I tell you it needs a crown and you know that it only has a small hole,
Right.
you're going to go, why do I need a crown? It's only a small hole. Child's not going to do that.
Right.
So children are another group that's that way. And the last one is insurance companies. If you belong to an insurance company and you have a limited number of participating dentists,
Right.
for instance, you belong to X insurance company. There's only one guy in town that accepts it versus 10. The insurance company doesn't look at their statistics because you're the only guy in town. So he can get away with things like he can say, okay, or she can say, instead of doing a regular cleaning, I did a gum cleaning, a deep cleaning,
Right.
treatment for gum disease. And they may overlook it because you're the only game in town that accepts their insurance policy.
Ah.
So they sort of can get away with more. So that's but I'm not saying all participating providers are that way. Don't
Just
get me
something to be
wrong.
aware of.
It's just, I'm not saying that. Yeah, I'm just
Okay.
saying that certain ones, when there's a limited number, they tend to get away with
All right,
more.
let me ask you this. You already said that you don't know what you don't know.
Yeah.
Is there something I can do to protect myself?
You know, it's really interesting, and I've thought about this over the years. And one of the dentist doesn't know what you know either.
Okay.
Okay? So when you ask questions, if I've got something to hide, I get fidgety. I get defensive. If I say, let me see the x-rays, you may have never looked at a dental x-ray before. Show me that cavity on the x-ray. I don't know that you don't know what a cavity looks like on the
Okay.
x-ray. So if I start getting weird and my body language starts changing,
Right.
so when you start asking for examples and explanations and copies where the person gets defensive in body language or verbally, something's up.
I don't have to be a
Something's up.
dentist, just pay attention to what my dentist is doing.
Something's up. And the other thing is resist the temptation to buy immediately. It's just the same thing as when you're, hey, anybody that pressures you, you got to do it now. We've got somebody else interested or anything like,
Right.
something's up, but they want you to sign now. They want you to do it immediately that day because they want you to do something before you've really thought through.
Right.
So anytime you get pressure like that, you really need to be leery of that. Because if you really are truly for the patient, you want the patient to understand what they're getting
Right.
before they get it. And if it takes time, you have to bring them back and you have to talk to them, to show them pictures.
Then it takes
That's
time.
all good.
Right.
That's education. That's what you should do. But to try to pressure them to do it right then or her to do it right then,
That's not
that's
good
a little
thing.
shady.
Dr. Joe Harmon, some excellent information. Thank you so much for sharing that with us today. Man, now if you would like to read more about Delmarva Dental Services, all you have to do is go to DelmarvaLife.com.